Thank you so much for joining us, recognizing how important your time is. This webinar is part of Global Mental Health Action Network's hashtag Mental Health for All webinar series, which has been cultivating brave spaces with over 70 webinars since April 2020. I would like to encourage our dear participants today to please introduce yourself through chat. I invite you to share your name, your organization, and the country where you're joining in from. We are expecting to have a lovely and diverse mix of people coming from different regions, roles, perspectives, contexts, and stories. And so may we work together to create, preserve, and maintain a safe and dignified space for dialogue to the best we can today. I am Nero Alonza. I'm a Filipino activist and psychosocial support specialist from CARI, Caring for Activists, and I'm also the co-chair of the Global Mental Health Action Network's Environment Working Group. And we are joined here today by an empowering group of healers, advocates, and leaders from around the world. They will accompany us today in defining more about what allyship and social participation looks like and how they are placed in the broader critical conversations on decolonization in global mental health. To get us to know them better, I'd like to ask each panelist to introduce themselves with very briefly in one sentence. First, I'd like to call on Lara.
Thanks so much. Hi, everybody, and it's great to be here. My name is Lara Braley, and I'm a consultant working with a special program on primary healthcare at WHO.
Thank you so much. I'd like to hear from Franco.
Hello, everyone. My name is Franco Mascayano. I'm from Chile. I'm based in New York at Columbia University. I'm a researcher. Happy to be here.
Thank you so much. Let's hear from Natalie.
Hello, everyone. I'm Natalie. I'm from Liberating Knowledge and the Centre for Public Impact.
And Anjali.
Hi, everyone. My name is Anjali, and I'm a psychologist and a researcher from India.
Thank you so much for those brief introductions, and we're so excited to get to know each one of you more. And I would like to encourage our participants today, if any question happens to arise in the conversation or throughout our dialogue, please feel free to share them throughout our chat. Now, to lay the landscape on this topic, Lara, I'd like to ask you, could you please update us on what happened at the World Health Assembly to the WHO resolution on social participation for universal health coverage, and what are the next steps for implementation? Can you walk us through that?
Thanks so much, Naro. Yes, of course. And thanks to you all for being here today. And I have a few slides. I'll try not to bore everybody with too many of them, but I'll go briefly too and looking forward to the discussion further on. I just wanted to quickly acknowledge my colleague Kiara Koch, who's on the group as well, and she will kindly come in to add anything I miss or complement later on in the presentation. This is something we've been working closely on together with many of you and others along the way. I will also post some links into the chat after my presentation that might be helpful if you want to look any more closely at some of the documents and products that I mentioned along the way. The next slide, please. So this is a very messy slide that just tries to indicate and convey that it's been a long and busy process with growing momentum over time. It's really involved a lot of activity at regional levels, with member states leading action in regional committees of the WHO, with resolutions and side events. There's been technical products along the way, notably the handbook that WHO produced in 2021. There's been a series of consultations with different stakeholders to try and get inputs into reactions to what priorities should be in the movement towards a resolution. There were dialogues between the WHO DG and civil society, agreeing on this being an important topic for attention at an assembly. There was a social participation technical network that was a multi-stakeholder network convened to support the production of the handbook that also focused on advocacy with member states and civil society and others, identifying common priorities to move this agenda forwards. So it's been a kind of building momentum over time with lots of different angles to it to get to where we are today. We'll move to the next slide, please. So this has really been led, the process towards the resolution more specifically has been led, as people will know, it's a member state process to have a resolution at the Assembly. And this has been led by the co-chairs of Slovenia and Thailand, and they've had very close support from a core group, including Brazil, France, Norway, and Tunisia. The next slide, please. It's been a long process as well of negotiations on the resolution itself between member states. This core group followed a protocol to initiate the process with a concept note and circulated a zero draft of the text. This was followed by close negotiations between member states. These are confidential negotiations that happen only among member states, with WHO to provide technical input to the process. But the co-chairs and the core group were also very took initiative and really wanted the process to be more participatory. And so they have also consulted civil society during the negotiation process with several consultations to get inputs and hear reflections and priorities from civil society through the process. And there will be a subsequent consultation with civil society following the adoption of the resolution. The next slide, please. So various side events also happened that convened a whole load of partners. One was at the World Health Assembly last year, where member states really initiated the process and stated their intent to pursue a resolution. And then this year at the Assembly, there was another side event that was led by a range of partners, including civil society again, but also member states and other partnerships, to really focus on the opportunity of social participation to help facilitate a step change, a paradigm shift in how governance for health is taken forwards to achieve our common goals. And then I just want to focus on the next two slides before I stop. So the next slide, please. Oh, not this one, the one after this. So at the side event, there was also a special issue of the EuroHealth journal launched, which I'll send the link to in the chat in a moment. And that helped synthesize much of what was in the WHO handbook and country experiences, but with the voices of different stakeholders. And it's quite a helpful, concise way of capturing what social participation is about, why it's important, and how it can be advanced at country level. And then the resolution itself. So this slide I'll focus on for a couple of minutes, if that's okay. And here I wanted to just focus in on what the resolution asks for. So in the WHO resolution, and some of you may be familiar with the format, there are preambular paragraphs that talk about why it's important and what it relates to in previous commitments and so on. And then there are operational paragraphs that hone in on actions to be taken. And this resolution has two sets of operational paragraphs. The first focuses on actions for member states. So on this slide, you will see that it highlights certain areas of priority actions for member states. This includes strengthening public sector capacities and the capacities of civil society to meaningfully engage. It includes enabling equitable, diverse, and inclusive participation, and especially the participation of those in vulnerable and marginalized situations. And here, I think this really gets to the heart of this point that has come up in the decolonisation narratives about shifting power imbalances. Then it talks about policy uptake of recommendations. So participatory processes should really have an impact on decisions that are made. It talks about implementing and sustaining regular range of mechanisms. So it's no one size fits all, and it can happen in different ways at different levels of the system and across the policy cycle. And it's really about building trust over time with this regular engagement with different stakeholders to build that trust and relationship and a mutual respect for one another. And then it's about allocating adequate and sustainable public sector resources. And it's important to monitor and evaluate and conduct research to ensure that the quality of implementation and the impact it's having followed. The next slide, please. The operational paragraphs also focus on what WHO should do. So the DG, the WHO Director General, is asked to ensure that WHO advocates on the importance of social participation, keeping political attention on the agenda, that it develops technical products and operational tools. So, for example, it specifies work to strengthen monitoring and evaluation and metrics for social participation. And for example, there's an e-course on social participation building on the handbook that is in the pipeline. To continue to provide technical assistance to countries on their request, to document and disseminate country experiences, and to do this to facilitate a multi-stakeholder network where member states, civil society, and other partners can facilitate collaboration on many of these functions. So, for example, learning and exchange, advocacy, with time-bound working groups that focus on technical deliverables potentially. It also asked WHO to better harmonize its work on social participation across the levels and the departments of WHO so that we promote coherence in the normative guidance and the technical assistance that's provided to countries. And then finally, to report on progress. So I'll stop here, but hopefully that gives you a sense of what the resolution calls for. And just to convey that there's very exciting energy we've noticed since the resolution was adopted last week amongst a whole range of stakeholders. So we're seeing a lot of enthusiasm amongst member states across our organization at WHO and also with partners about how do we really take this forward from principles to action and make sure that it translates into progress at country level. Thank you.
Speaking of action, and Lara, you were mentioning about the social engagements involving multi-stakeholder dialogues and negotiations, with an emphasis on participatory consultations and partnerships, with the intent of capturing and including as much voices as possible and shifting the power. And so I'd like to hear from Franco. Could you please outline the decolonial approach you took in your Heroes program and what your pragmatic solidarity approach means in practice for global mental health advocates?
Sure. Well, hello again. Um, so let me give you some background about Heroes. So Heroes was an epidemiological study that was led by people in Latin America, especially, but with a close collaboration with researchers and practitioners in many other countries. It was created in, I think, March 2020 in the context of the COVID-19 pandemic. And our main goal was to focus on a very vulnerable population, meaning healthcare workers and their mental health. So the original idea was to do, I guess, what you could call a regular global study, but we had no funding, so we relied on volunteers all over, the world, and we were connecting with our friends and colleagues, in Europe, in Africa, and so on. What makes Heroes special was that it was a bottom-up. You know, l- South-led project. It was a research project, but it became much more over time. And there were specific features of the project that made it very special. For example, we had our data center located in Chile, which for a global, initiative is very unusual. As you may know, most, global health research is led by institutions in the north who usually have the know-how in terms of getting funding and just leading these global initiatives. So having Chile as the main site and like collaborating with uh, countries like the UK or the Netherlands or Germany was very unique, as you may imagine. And for the Chileans was a big challenge, but they did a wonderful job just taking the lead, helping them, to set up their, data systems, collecting, good data, analyzing data, etc. So that was our original intention. However, when we were doing this, we thought maybe what we're doing is something, decolonial, something that you could call a decolonial approach. So we came up with this framework, if you will, that was published in the Lancet Psychiatry at the end of 2022. I can send you the paper, which we call a decolonial approach, the Heroes decolonial approach. It's based on three principles. The first being epistemic justice, which for us meant to give everyone the opportunity to talk, to share, their experiences, their knowledges. There were people from countries that are usually not included or invited, to global initiatives, like people from Uruguay or Armenia, many people from Africa, really leading or co-leading this initiative. So we wanted to create a space for them to express whatever they want to, say, and to truly collaborate with other teams in other countries. Then pragmatic solidarity, which in very basic terms means to help, other countries, some countries helping other countries, basically people helping people. So the data center we had in Chile was free of charge, was created by the Chileans, and many teams in all these countries, many of them being LMICs, didn't have the resources or the people to do such a thing. So the Chileans just provided support and say, you can use our platform for free. There's no fee involved, because that's another very bad practice that you can find in the field. Some of you might have participated in global, studies where countries have to pay for, using a specific instrument, or to just like join in a paper, or things that are like just terrible, but they still happen, right? So we wanted to really do things differently. So we offered like concrete support, right? And the third principle was sovereign acts, which again is very common sense. But we basically, said to teams, you guys are collecting this data. This is your study. So you can publish the data whenever you want. You can use it for whatever purpose you define. If you want to send it to Ministry of Health or to other stakeholders, it's up to you. The only thing we are suggesting is that you keep some level of quality, so we trust the data we are collecting, and we can do things that we can call like global papers, like comparing data across countries, and that's it, really. So I would say they love that. So regarding your specific question on pragmatic solidarity, it's very simple. It's like if the guys in Spain got a grant and they could help the Chileans to keep, the data center going, they did that. If the Brazilians, develop a way to intervene some of these factors that we were, characterizing in terms of mental health at work, they shared that knowledge with the guys, now in Germany. So we had many examples of like countries collaborating with other countries, with us just trying to create the space and facilitating, the communication. So it's not rocket science at all. It's just, creating the space, letting people to work together, and not having this very strict old school policies from, research agencies, so that sometimes just they just don't help. So in a nutshell, that's what we did.
And as you've started to touch on decolonization and following or aligning with the principle of systemic justice, perhaps Natalie, could you share with us, in your experience, how can global mental health advocates be good allies, especially towards race equity in mental health?
Thank you. So I've been sort of like grappling a bit with like the whole concept, like what do we mean by decolonisation, and what is the role of allyship, in particular in the context of global mental health. And the term decolonisation is increasingly being spoken about in more mainstream spaces, and I have mixed feelings about this. In that it's great that the concept is kind of reaching wider audiences, but how do we prevent it from becoming just another buzzword? And in practice, it doesn't lead to material change for communities who experience marginalisation. And a quote I wanted to share was from Kahindi Andrews, where he says, acknowledging the barbarity of the West is meaningless unless we're committed to undoing the system that has created it. So, how do we go about beginning to dismantle this system? And I think one of my reflections is that when we're often talking about mental health, we talk about it from the perspective that it is preventable. But what I find is often absent from the narrative is really acknowledging how the legacy of the transatlantic slave trade, how colonization and empire is still very much present in global mental health today, and how that has shaped our attitudes towards mental health, the policies that are in place, our practices, and power dynamics that both kind of create and reinforce the harms that many think are now a thing of the past. And so I feel it's really important for us to kind of engage in the history, as because this will help us to recognize how it continues to show up, both in like really subtle but also prominent ways in society, in our lives and our work. Um, and it kind of move us away from kind of focusing on kind of just helping communities to cope with the suffering that's caused by racism, or but really focusing on how we start to address systemic barriers, um, and rather than kind of just supporting people around coping with the oppression that they face or that we face. And I think we really need to think about how we work more systemically as a whole. And that really helps us move away from blaming individuals and communities towards more systemic solutions. And so I guess, what does a good ally look like? What does good allyship look like? Well, I just wanted to refer to a comment from, or a thought from kind of Professor Kamara Jones, where she says that kind of allyship can sometimes be a bit problematic, in the sense that it can give people permission to tap out when it gets too tough. And we've kind of seen this, um, you know, after the murder of George Floyd, and the rise of, the Black Lives Matter movement. We saw the emergence of allyship fatigue, and that actually became a thing. Um, and so, one of the things I think it's really important for us to think about is how one's privilege and positional power can give them permission to just step back and stop doing this work. But for communities who are targeted by racism, like there's no escape. This is our everyday reality. And so, how can we work in solidarity with communities, and being and kind of sharing in the struggle, as it were? And I think some of this also comes from the perspective that addressing racism will only benefit Indigenous communities or Black people, or brown communities or people of colour. But Professor Jones reminds us that racism is bad for everyone. And so, if we kind of think about it from that perspective, how different might our questions be, or interventions change? So, I guess in our work, in my work, I find that race is a useful lens to explore inequalities. People often worry about overlooking other forms of discrimination, but focusing on race doesn't have to be at the expense of addressing the other isms, especially if we're taking an intersectional approach and recognise that they're interlinked and reinforce one another. And I think the other element is knowing when to stand up, doing your share of the labour, but also knowing when to get out of the way. So when I'm talking about standing up, are we recognising our privilege and our power? And are we working in solidarity with communities? Are we using our influence? Are we challenging for practice? Are we advocating for this work to be resourced? When it comes to sharing our labour, you know, we need to be in this for the long haul. This is not just your role. This is your life, and it's not just it's not just your life's work. And it's really moving from a kind of intellectual understanding of anti-racism to like an embodied practice. And then I think the other thing is that what gets in the way, and I think the charitable sector as well as the private sector is guilty of building empires. Many of our missions are to expand our reach into the global south in pursuit of doing good. But this expansion often sort of mirrors capitalism and saviorism, which is rooted in the belief that communities from the global south, or who are in the diaspora, are incapable of finding solutions themselves. So we really need to start asking ourselves quite critical questions. One, whether we should be leading this work. Are we really centering the voices of communities? And trusting that we can, and we show that we do innovate in so many ways, and really focusing on learning so that actually there is that space to kind of test and experiment. And then there is that kind of, we're increasingly hearing about like epistemic injustice, which really highlights the power dynamics in producing knowledge, which essentially shapes what we know about mental health. It frames the narrative, and it also determines what we view as being a credible intervention. And what we have to remember is that much of the research is kind of framed from a Eurocentric perspective. It's deeply embedded in the medical model. It overlooks and even diminishes the value of Indigenous, African centres and other knowledge systems from the global south. And another way of us also kind of getting, it's kind of, I suppose, acting in solidarity is ensuring that we're resourcing communities to have the space to be able to imagine alternative futures, to be able to reflect, and really kind of creating space for healing, but also for our joy.
Continuing the conversation on systemic dismantling, I wanted to ask you, Viet, in your experience, how can global mental health advocates promote equity at the intersection of sexuality and gender diversity and mental health through decolonial approaches? And you can start with introducing yourself first.
Hello everyone. I know that I joined a little bit late due to some technical difficulties, but I'm very glad that I'm here at least. And I was very happy when I got to listen to some of the insights from Franco and as well as Natalie. As for myself, to introduce, my name is Viet. I use he, him, his pronouns. Currently, I'm serving as the Director of Programs here at Lighthouse Social Enterprise, a leading civil society organization in Vietnam focused on health equity and especially mental health equity for young key populations and young LGBTQI plus adults. And also, I happen to be the chair of the LGBTQI plus network in Vietnam. And given my experience, I believe that I have some like just some insights because I know that like they can't be all, and I'm very excited to learn some more insights from all of you as well. But for the question that Naro graciously gave me, I think there are two things that I would like to mention. The first thing is that we're like we ought to reassess our perceptions of what LGBTQI plus mental health equity means, and in a way that we need to acknowledge the fact that this like the stigma against sexual orientation and gender identity was first introduced by a lot of colonial countries, to many of these like many of these colonies back in the days, where a lot of these capitalistic and also oppressive ideologies were supplanted to these countries, in which none of those things ever existed before. In my country, Vietnam, before France and even the States intervened into our peace, we had a lot of sexual and gender diversity, and it's only not until um, like the introduction of some of the Western ideologies that a lot of the diversity was like started to be frowned upon rather than celebrated. So I think like acknowledging the shift in the narrative and like also the historical context would give you a lot of power, in acknowledging the fact that even up until these days, the LGBTQ plus rights movement has thrived all across the globe and often are strengthened, from like the global north, and then being passed down in different waves to the global south. um, and in the same vein, like a lot of the ideology when it comes to equity, um, like were never like renovated or adapted to fit the cultural context where a lot of these biases were supplanted. So I think like that's the first thing that we need to acknowledge. And also as we're like as we're like reassessing our perceptions of what mental health equity means for queer and trans folks, we need to also understand and truly um, sympathize with some of the cultural, um, like the cultural significance of some of what we would consider to be barriers. So, for example, there are a lot of social cultural ideas that might hinder some progress when it comes to mental health equity, and that could go, to like filial piety, it could be social orders, it could be like harmony. Those are like the common values in Asian societies up until these days that many advocates find as barriers, when it comes to, getting the people, to deliver their voices and speak up about their own, experiences. And sometimes, with these social like and cultural ideas, we have to accept that we can't really change them to the extent where we would want to, like to do, given that agenda that might be passed from like the global north, that you need to, like you need to speak up. You don't have to fear anybody. You're like your own person. Like none of those things might actually be applicable, to some of the Asian context here. So I think that's the first thing. And I think like the second thing that is also very important is the fact that, as advocates, we need to collaborate, with queer and trans folks in terms of reimagining, what it means, to be, like what they would want us, to advocate for them. And I think like the first thing that is just so crucial is the fact that we need to relinquish, these guiding frameworks that we have been operating on for so long, that has been rooted, in the Western ideologies. At first, like it might be, just very overwhelming, because that has been your like in your brain for so long, and now you don't have those like guiding things anymore. But I think like in that sense, or like that lack of balance, I think it comes with a deal of hope, because you're getting to invent something that was never there, that was never like never there, like in the beginning, and you were kind of like being pushed on, by that idea. So I think, as you're getting this sense of hope, it's very important that we put, queer and trans folks in the driver's seat in terms of that reimagination of what mental health equity might look like. And that goes along in terms of we should listen to them for what they need. And that might, clash with our expectations. I feel like a lot of advocates kind of like struggle, to kind of navigate, like our expectations as advocates, and like the beneficiaries that we're serving. Sometimes we just really want to push them, to the forefront, and they need to speak up, because we know that, their voices would go along in making certain movements more strengthened, for example. But in a lot of ways, we need to understand that, for a lot of, queer and trans folks, they might not understand, mental health fully. And in order for us to, to get them to understand and deliver their voices, we might have to advocate through another thing. And that could be HIV and AIDS, that could be gender-based violence, that could be like economic empowerment, any of those things that would help us bridge the gap, and inspire these individuals, to think of mental health in some ways that would be a little bit more intimate, and close to them, would be very important. Because at the end of the day, if we kind of like walk back in terms of history, when a lot of Western ideas came into, like a lot of Asian contexts, sexual and gender diversity was marketed as like a mental disorder. And up until these days, a lot of these ideas are not, like eradicated at all. In many healthcare systems in Asia, psychiatrists, psychologists, they still think that, being LGBTQI plus is still like a mental illness. So all in all, I think, as advocates, we first need to reassess our perceptions of what LGBTQI plus mental health equity would look like, and then we need to collaborate with our queer and trans friends, and reimagine that sense of equity.
So we've already began unpacking and reimagining about culture, gender, sexuality, and race. Anjali, can you help us in broadening this further to talk about age? Can you share with us what does empowered youth leadership in global mental health look like, and what do decolonial perceptions of mental health mean for young people today?
Thank you, and also absolutely enjoying the inputs, and I relate. I was nodding throughout everybody's bits, and for me, I think colonialism. We like to think that it doesn't exist anymore. What it has done is it's evolved and it's gotten hidden into different in all structures today. It just is not the same way you would see it maybe 20 years ago or 30 years ago. That doesn't mean it's magically gone. It's built on certain things and certain, sort of smoke screens. The first one is that we love to deny realities of people. we are built on denying lived experiences of many communities because it makes us feel good about ourselves. We like to believe in the idea of equality. We love to believe that equality exists. And it makes us feel good about ourselves. We think we are doing good work. What it does is it removes very real, very intense experiences of people that deserve to be talked about. Because as practitioners, as policymakers, we have to learn that not all discomfort is bad. Sometimes it's telling us of what has been missed and what needs to be talked about. It's built on concentration of power. Um, where are conferences held? Which institutions are good institutions for research or mental health? Who gets to have a visa to attend a good opportunity, let's say? um, all of these build up, and there has been a systematic um, exclusion and gatekeeping. So when we talk about decolonializing or lived experiences or youth engagement, we have to be really, really careful of not getting stuck in tokenism. We have to move beyond it. We have to see, can we share power here? Can, within the organizations that we work in or we hold space in, what does restructuring and recentering of power looks like? What are we calling good research? What is credible data? Um, and really building on from there. Um, as somebody who was young a few years ago and was doing a lot of work on youth engagement, it often felt that it was just, I was just stuck there. I was a young person saying what I had to because made the group felt better, that a, a checklist was sort of completed with my presence there. If we really want to engage young people today, we really need to look at what does what is creating meaningful roles which have a proper growth trajectory. What do that look like? What does the representation of are we ready to hear what young people have to say? Because they know better than us what their concerns are, what their lived experience is. The point is, do we have capacity as organizations to hold that input, to do something with that input? Also, when it comes to just the perception of mental health and distress, is it depression or is it unemployment? Is it really that a young person's being problematic, or that there is constant violence, constant dysregulation around them? um, for so far, colonial systems of care would place the burden on the individual that you need to cope differently, avoiding any accountability on the systems around this person. So when we talk about youth engagement, are we ready to take that input that systems around you don't work? Can we look at building stronger institutions within the global south that don't need to be dependent on the global north? Can we look at equity in terms of just opportunities? So many of the key uh, conferences or events, they happen in parts of the world where my passport can't get me and it's expensive. Visa costs, registration costs, even just the act of sort of getting there. We have to name that not all bodies are equal, and can we talk about it? Can we then start from there, that we are not all equal? How do we get to that point of equity? And we have to be with that discomfort and name it. Really, truly, to be doing decolonial work, like, you know, it's been said before here that it's not really complicated. It isn't. It's right in front of us. What it does need from us, what it does demand from us is shifting away from the convention or conventional standards, and that's where we need to look at. So to answer your question, I think for young people, we need meaningful roles. We need to move beyond tokenism, and we need to look at where these roles are centered. Are they more in one part of the world? Who has access to them? And is there truly a scope for equity at the table? And really building from there. Thank you.
So we've heard from our panelists, and in the spirit of equity and in the spirit of sharing and doing our share of labor, I'd like to invite our audience to please kindly share your questions into our chat. Please feel free, and we'll be opening up this space so that we can have a more interactive element. And first, I'd like to share with you one of the questions that was asked, which is there a coalition of mental health activists collaborating with each other in helping take action? We are here right now. So we have Global Mental Health Action Network, which you can actually join in and participate and engage in many different ways. And I'll be asking another question that is shared by another member of the audience, but I will be reframing it, Anu, if you will. So after this webinar, right? After this webinar, how can we play an active role in this and gain opportunities in this arena? And any one of the panelists can feel free to jump in and answer.
So I'll jump in. So there are, I mean, decolonisation is not new, and there have been people kind of working in this area for like decades, if not yeah, so there are universities that kind of are really sort of specialising in these arenas, but there are also informal groups around decolonisation. So at the Centre for Public Impact, we have a team that is focusing on decolonising the development sector. So if you have any kind of interests in that respect, then I can certainly connect you with people in my team. But I can also share with the team after some other kind of organisations that may be of interest. And the other thing to remember is that some people are doing this work, but they're not using that label of decolonisation. So that's also something to be mindful of.
Perhaps another panelist can jump in to share. How can we engage and participate in this process? Perhaps Franco? Lara, sorry. Please go ahead.
Sorry, I was trying to come in to fill the void, but I'm happy to go after Franco.
Please go.
Okay, I just wanted to come in. I mean, I touching on this question, but also the one from Antonis in the chat. But I wanted to just echo a lot of what people have said about how this is really about shifting power balances, and I think for this, it's really interesting how, firstly, we see that all countries can do something differently, and all stakeholders can get involved in different ways. And it's easy to say that because, of course, power structures inhibit space for many to organize and to be heard. But at the same time, I mean, the one thing I think the resolution does do, despite the very difficult climate we're working in at the moment in terms of international diplomacy and so on, I think we've seen that it hasn't weakened the language on inclusivity and inclusiveness and equity and diversity. And this point is a really important one that I think activists and others can hold on to and hold their governments to account for as countries do move towards trying to implement and strengthen social participation in their contexts. And here it's really about not just the lived experiences, needs, and preferences of people, but also about how do we make sure that the value of these are understood and heard, and the space is provided for participation. And the resolution focuses really on institutional, well, it doesn't use the language, but on having participation as part of the system, shifting towards a new modus operandi or a paradigm shift in how governance for health operates and the roles of different stakeholders in this power shift. However, I think it also hints at the importance of both this kind of invited space for participation, but also claimed spaces for participation. And here, activism, I think, is a very important complement, and advocacy more generally, to more institutionalized mechanisms for participation. So in terms of what stakeholders can do, they can be part of the system, but they can also be around the system calling for change. And I think it's that complementarity that's very rich when we see change happening at country level.
Will the other panelists like to add to that question?
I think I could jump in just for a little bit. I think a lot of us talked about solidarity when it comes to social participation, and especially coming from marginalized populations. I think like Natalie already touched on this, and so did Franco. But I think it's important for us to recognize the fact that even for us, when we're advocating for mental health at a very general level, to a lot of policymakers, to a lot of these like high level stakeholders, we often feel like this pressure that we should not name another thing in tangent. I mean, like in tandem with it. For example, like LGBTQ plus mental health, for example, or climate when it comes to mental health, especially in that intersection. So I feel like there's like just like this invisible pressure, for a lot of advocates, and you might feel that as well, that you might be able to only advocate for one thing and not the intersection of multiple things. And I feel like that shouldn't be the way. And I hope that, after this webinar, we could kind of like brainstorm together and then reimagine different ways through which we could, better advocate for, like the inclusion and also for some more diversity in terms of global mental health advocacy.
I'll be asking another question from our audience. This one is directed to Anjali, but the other panelists are free to add their comments later on. But what is the material implications or harms of not recognizing systems and overly focusing on the individual? E.g., your example that you're not coping effectively.
Thank you for that question. The first and foremost harm is that it's equivalent to not recognizing somebody's reality, right? And only focusing on the reaction. Let me ask you a question, and this is a practice for everyone. If I switched on the alarms of wherever you are sitting, and I just played on that alarm constantly, and then you ran out, and I said, hey, why are you running? Why is this bothering you? Would you not feel odd? Would you not feel a sense of discomfort? That is essentially what is happening, right? Somebody's experiences of oppression, of being othered, of being told that they are not worthy of that sense of safety and acknowledgement, and they need to do more, is essentially doing that. And what that does is it creates the systemic and generational cycle of just not of normalizing discomfort, of normalizing pain, of discrediting somebody's experiences. A very well studied example of this is that people of color are less likely to be prescribed pain medication, for instance. Why? Because a certain body, a certain kind of body, is perceived to be um, harsher or stronger as opposed to a certain other kind. So when we say that no, let's talk about you and isolate you from your systems, it it reinforces the narrative that something is flawed within you and you are not doing enough, and it reinforces this generational wound of inadequacy that I need to keep doing more and more and more when um, and it's not fair at the same time, because those with certain power and privileges get to have a very, very different life and very different life trajectory from there on. So I think that is the core of why we need to look at systems. these systems are built by the people, for the people, so who all get to access them and how they get to access them and how they build them is a very central question in mental health practice.
It's such a huge, huge shame that unfortunately we don't have any more time to go through all of these very important questions that were asked from our audience. But definitely these will be continued in our circle platform. But to summarize our takeaways and insights for today, I would like our panelists to complete a statement, and I'll be calling each one to share in a while. But I also would like to invite the audience to share your answers in the chat. And the statement is: for a decolonized global mental health future, Action members can blank. Okay, and I'll be answering first. Action members can brave the importance of discomfort. And I'd like to hear from, I'm plagiarizing, didn't I? But I'd like to hear from Lara.
Hi, I love your brevity. It's a wonderful one. I had a much longer and more tedious response, but I'll have a go anyway. So they can pursue implementation of the resolution on social participation and hold their governments to account so that the lived experiences, needs, and preferences of people, communities, and civil society, especially those in vulnerable and marginalized situations, shape the decisions that affect their health.
Franco, I'd like to hear from you.
Well, I didn't know that we had to come up with something like that, so I'll just improvise, I guess. I think for a decolonized global mental health future, Action Network members can, I think, share resources, provide concrete and substantial help to one another, especially the people and the states and the countries that have more. I know that that's been said for a long time. I know that the war is full of people with good intentions, but in my experience, especially in research, that happens rarely. That almost never happens, you know. So I would suggest that.
How about you, Viet?
I guess for me, for a decolonized global mental health future, I think Action Network members can ask, their queer and trans beneficiaries in their own countries how these individuals defined mental health equity. The reimagination of global mental health should and must, shift the power dynamics for the communities that have been historically harmed by psychology as a discipline.
Natalie.
So for decolonised global mental health future, I think Action Network members can, I think, better engage with and kind of have an understanding of the legacy of colonisation, and in particular ensuring that the voices of communities who are most impacted are actually front and centre when it comes to leading change.
Angeli.
A lot has been said already, but for a decolonized global mental health future, Action Network members can recognize that collective justice is a core part of mental health care.
And with that, on behalf of everyone here today and those who will hear this webinar in some other time, I want to share our collective appreciation to the panelists. Thank you, Lara, Franco, Viet, Natalie, and Angeli, for all your care work, your devotion, and commitment towards the mental health and well being of peoples around the world. Thank you to the audience for choosing to be here and being with us. We're hopeful and we're looking forward to seeing you in our future webinars. To all those here today, please know that this webinar is only a beginning. We will continue to nourish and grow this dialogue on allyship and social participation in the Global Mental Health Action Network Circle platform, which will be shared as a link. You are free to join and to continue this conversation that we have just started. May the world be kinder and more tender where you are, everyone. Amping amping, take care.